dry disease affects 40 million people in the United States. And when I graduated school 2001, a long time ago, you can tell by my gray hair, the only people that had dry eye symptoms were those people, middle-aged women going through menopause, or people with autoimmune issues, or taking, a bunch of antidepressant medications or autoimmune medications. Well, we have just as many people in their 20s getting with dry eye related symptoms because of all this screen time. And so the need is really there. I always have a passion for being able to be a unique practice, being able to not having to be in a system where someone's telling me that I can or cannot purchase a certain piece of equipment, or bring in a certain eye drop, or do this or that. So that's really benefited our patients. And, people drive to our Midwest Dry Center locations more than a couple hours away. I have people drive from 3 hours away. And I always chime in on a lot of the popular patient dry eye Facebook groups. And, it's frustrating for me because patients don't know what they don't know, right? In this day and age, you have to really be your own advocate, whether it's seeking out a new high blood pressure medication, or lifestyle change with your physician, or, because doctors are so quick to prescribe rather than treat lifestyle changes. And when it comes to dry eye stuff, they just aren't familiar. You can Google dry eye, and, all these commercial optometry practices, or, even private practice optometry offices say dry eye, but it's no more than just giving you eye drops or prescribing something. It's not going to the root cause. So patients don't know that. And when I chime in on these Facebook groups, they're like, "Oh, I just want to how do we tell everybody from, and it I shouldn't be the exception. I should be the rule in terms of how you practice dry eye." And the same thing goes with myopia management, where these kids' eyes are getting worse every year. And there's something that's been approved for over 20 years to wear a contact lens at night, like a retainer, to stop the nearsightedness. And even if you're an optometrist in a system like a commercial setting, I wouldn't be able to sleep at night if I knew there was a treatment existed that could be halting the progression of their prescription, even if they don't do it in their own office. I mean, I refer patients all the time with us to our retinal specialist, or somebody really needs vision therapy that I don't provide that level of vision therapy. I always tell the patients, I'm not here to see every single patient. I'm here what's in the best interest. And if it's better for you, if I think it is better suited to go to my colleague, by all means, as a parent myself, that's what you want. So when it comes to dry eye stuff, that's kind of the same kind of thinking and methodology I go by.